Hi there, my name is Dr. Marianne Gauche-Hill. I'm the medical director for the Los Angeles County EMS agency, and it's my pleasure to join you today to talk about our collaborative response to the COVID-19 pandemic. Here we go. The title of my comments today are Collaboration of Emergency Medical Services and Public Health in Response to the Pandemic. I think it's very important to understand that a collaborative response and coordination was absolutely necessary in order to meet the needs of the public during the pandemic. First, I want to tell you a little bit about emergency medical services. When you think of pre-hospital care, this is what you think about, right? Ambulances, helicopters, EMTs and paramedics coming to the scene of accidents or serious illness or injuries such as stroke and heart attacks. Just to frame things a bit, Los Angeles, it's a complex healthcare system. It's one of the largest emergency medical systems in the world and was one of the first to be developed in 1969. We have a huge workforce with over 12,000 individuals serving either as paramedics, EMTs, or mobile intensive care nurses that actually provide online medical direction. In addition, we have physicians and nurses that work at our 70 acute care receiving facilities. Just to say that these individuals will transport patients to our receiving centers, and we have a wide array of services that are available in a regionalized emergency medical services system. So just to provide a bit of structure and framing the complexity of our healthcare system. When COVID-19 hit, we all had to transition from what we do from day to day to disaster management. The impact not only was on us as a system, but also on us as individuals and healthcare workers. As someone who's an emergency medicine physician, I switched from the way I see patients to seeing patients in full PPE. It was a transition for all of us. I thought I would frame some of our response based on an anatomy of pandemic response. So there's many things that we have to think about. Declaration, collaboration, and coordination, collection of data, communication, innovation, allocation and distribution of PPE, we'll talk about that in therapeutics, vaccination, and then finally evaluation. First of all, there needed to be a declaration on March 4th, 2020. The mayor declared a public health emergency. So did the governor and the president of the United States. So at that point, we were all in. We stood up multiple disaster operations centers around LA County, and the various agencies that we collaborated and coordinated with throughout this pandemic response we're up and running, and we've begun the task of meeting the needs of the public, facing the pandemic head on, and beginning to develop strategies that would help keep us safe. These are the organizations that we have worked with: the Office of Emergency Management, Hospital Association of Southern California, our state EMS authority, which has been instrumental along with California Department of Public Health in communicating with our federal partners and bringing us therapeutics and personal protective equipment, or PPE. Los Angeles County Department of Public Health, of course, and our agency. I'd be remiss if I didn't mention our LA area fire chiefs who were instrumental in terms of standing up testing centers, as well as now manning vaccination centers and megapods. They have been absolutely a critical partner in this, as well as our federal partners. The USNS Mercy came early on during the pandemic to help us offload our hospitals for non-COVID patients, as well as providing personnel that went to a number of our acute care hospitals, as well as skilled nursing facilities. In addition, we had the California National Guard, as well as the Army Corps of Engineers, here to help us. Some of the innovation, which I'll get to in the next slide a bit, is Operation Warp Speed, which, as you know, has brought vaccines, and that public-private partnership has brought wonderful strategies and therapeutics to us. In order to help guide us throughout this, we had to collect data. And this turned out to be absolutely critical in order to anticipate what was coming. And as you can see in this graph, you see the initial, over here was the initial wave, but then in the summer in July, and then this huge surge that we just experienced over Christmas and New Year's. Understanding that we were in this portion of the curve was absolutely critical for us to work with hospitals and all of our stakeholders to meet the needs. In addition, we have a medical alert center, which operates 24/7, who's able to collect data, help provide transfers, and give us the information we need from a regional planning perspective. On this graph, this is a diversion report, and you can see almost all of the hospitals at this time period during our huge surge were on ALS diversion. What that means is everybody was open, basically. But in addition, we were able to utilize data from this in various regions of the county to plan and work with hospitals to keep services open so that they would be, so in any one region, patients with, say a heart attack or stroke would have access to those therapies quickly. The other thing that was critical is communication. I think many of you have seen the dashboards that have been put up as locally, state, regionally, and at a national level. We did as well, and this communication with all of our stakeholders was critical to at least tell them what to anticipate, also to get feedback from them about what was happening in the field so that we could meet the needs. In addition, we put out a number of guidances, memos, and directives that would help manage the system during the time of surge. And then finally, working with our LA Public Health partners, we've had many webinars as well as conference calls, weekly conference calls with all of our stakeholders in each of the hospitals and their emergency management officers to help them work with the hospitals to meet the needs as we move forward. One of the things I wanted to mention, and it can't be underestimated the impact it had on the healthcare community, but was the support of healthcare providers on the front lines. This was from the flyover that was done in May during EMS week. And literally, healthcare workers came out of the hospital and stood outside to see these jets flying over and waving and saying thank you. It really meant a lot to all of us. Innovation is another part of the anatomy of response, and certainly PPE. That was critical. Many people made their own PPE. We had garbage bags used as gowns until really the supply chain could be reinforced. After that, we had our federal response. We were recycling N95 masks with the Battelle Recycling Center, which was really critical at that time. In addition, because of Operation Warp Speed and the development of therapeutics, we had strategies for allocation through Health and Human Services, as well as California Department of Public Health to us. And we were involved in getting therapeutics with emergency use authorizations to all of our acute care hospitals. And that was just brought so much hope when remdesivir came online. There was great hope, as well as dexamethasone. Communication amongst all the stakeholders. Again, we had leadership calls as well as calls with all of our stakeholders. And then, as I mentioned, but I think it can't be undervalued because this was absolutely critical to this, is leveraging public-private partnerships in order to meet the need, both for testing, vaccination, and distribution of therapeutics. This just shows you a picture of our warehouse. I'll go into a little more detail here. On the right are the list of our disaster resource centers, who all played a role in terms of distributing to all 70 hospitals in LA County. We distributed over 50 million items during this pandemic, and This is a list of items, and on the upper right, the biggest thing was the N95 masks that initially were in short supply. Now we have good supply. And then there was a concern about ventilators. That little box is actually a transport ventilator, but can be used for COVID-19 patients, as well as it has the ability to do high flow nasal cannula. So deliver high flow of oxygen to patients before they need to go on a ventilator. In addition, we distributed many tents. As you know, many of the hospitals had tents in order to care for patients outside. And so we were able to distribute those tents, both the Western shelters, DLX tents, et cetera, and certainly oxygen concentrators. One of the biggest things we did early on, and I'm very proud of our response here, is the allocation of remdesivir. As I said, this brought hope to many of us in the healthcare sector that we would again be able to treat these patients. And finally, now we're involved in helping support the convalescent plasma collection, as well as monoclonal antibodies. And these are antibodies that basically decrease viral load, which decreases the severity of illness. So pretty exciting stuff. And this is something that we're distributing. In addition, we had millions of pieces of equipment donated to us, which we were able to give out to many of our stakeholders, such as public safety, even some of the clinics, dental clinics, et cetera. And so we want to thank all of the donors. Moving on to what's next is vaccination. Vaccination is a true mitigation strategy. And there's great pride for many of the healthcare workers in receiving some of the first vaccine, knowing that they appreciated our service and wanted to keep us safe. And again, EMS played a huge role in this by allowing for expansion of the workforce to EMTs and paramedics to be able to stand up vaccination clinics, as well as to help vaccinate healthcare workers, EMS, and public safety personnel. And finally, as you know, the evaluation has just been data, information thrown at us on a daily basis. It's come fast and furious, but I'm thankful for the scientific community, which stepped up in a major way to support the healthcare sector in order to answer the most important questions needed in this pandemic. And finally, lessons learned. First, it's been a dynamic process. Data management was critical. Partnerships are absolutely what needs to be done. Communication, collaboration, and coordination was vital to rapid and effective responses in order to meet the needs of the public. I want to thank our state, regional, and federal partners for their help in keeping all the residents of Los Angeles safe. Thanks so much.